Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here we are discussing questions for AIIMS staff nurse exam, also RRB, AIIMS NORCET, DSSSB, Kerala PSC DME exam, Insurance Medical Service exam. Questions are from previous year question papers and also included important questions. So surely you will get an idea for your exam preparation. Let's start the question. Today's questions from Community Health Nursing. We will see questions one by one. First question. Dowry Prohibition Act was given in which year? Options: option A 1961, option B 1947, option C 1952, option D 1968. And the correct answer is option A 1961. Dowry Prohibition Act was given in 1961. And the next question, which of the following day falls 11th July? Options: option A World Population Day, option B UNO Day, option C World Food Day, option D World Health Day. July 11 is World Population Day. Option A is the correct answer. And the second option, UNA Day is October 24 and World Food Day is October 16 and World Health Day is April 7. Here July 11 is World Population Day. And the next question, fever, whooping cough, body ache are the clinical manifestations of options: option A diphtheria, option B pertussis, option C measles, option D mumps. Fever, whooping cough and body ache are the manifestations of pertussis. Option B is the correct answer. The causative organism of pertussis is Bordetella pertussis and its incubation period is 1 to 2 weeks. It is mainly transmitted by droplet infection or direct contact with secretions of infected persons. And the isolation period required for this infection is 4 weeks. Okay, isolation period is important. 4 weeks isolation is necessary for pertussis. Pertussis is also known as whooping cough or 100 days cough. 100 days cough is pertussis or whooping cough. We will see the next question. 8th day disease is options: option A rubella, option B diphtheria, option C tetanus neonatorum, option D plague. 8th day disease is also known as tetanus neonatorum. Option C is the correct answer. And the next question, quarantine was first used for which disease? Options: option A tetanus, option B chickenpox, option C measles, option D plague. Quarantine was first used in plague. Option D is the correct answer. Quarantine means we are separating the patient from a particular period of time, okay, to cure particular disease. Here correct answer is option D. And the next question, GOBI campaign. GOBI campaign has been promoted by options: option A WHO, option B UNICEF, option C UNDP, option D FAO. GOBI campaign, that is GOBI campaign, was started by UNICEF. Here answer will come option B, UNICEF. It includes 4 strategies for child health revolution that we can see. G means growth chart, O means oral rehydration, B means breastfeeding, I means immunization against 6 killer diseases. That is GOBI, growth chart, oral rehydration, breastfeeding and immunization. Second option, UNICEF. UNICEF means United Nations International Children's Emergency Fund, started in the year 1946, and UNDP means United Nations Development Program, started in the year 1966, and FAO means Food and Agriculture Organization, started in the year 1945. The year is very important point. And the next question, the new WHO ORS osmolarity is options: option A 270, option B 245, option C 290, option D 310. Osmolarity of ORS is 245. Option B is the correct answer. 245 milliosmol per liter. Here sodium 70 millimole per liter, potassium 20, chloride 65, citrate 10, dextrose 75. Total 245 milliosmol per liter. That is the osmolarity of ORS. Okay, here answer option B is the correct answer. The next question. ORS should be discarded after dash hours of preparation. Options. Option A 8 hours, option B 12 hours, option C 24 hours, option D 28 hours. ORS should be discarded after 24 hours of preparation. If it is not used, we should discard after 24 hours. The next question. Kala Azar is transmitted by options. Option A Phlebotomus serginiti, option B Phlebotomus argentipes, option C Phlebotomus pepatacea, and option D none of this. Kala Azar is a vector-borne disease and its causative organism is Leishmania donovani, and it is transmitted by sandfly species organism and its name is Phlebotomus argentipes. Okay, here option B is the correct answer. It is difficult to pronounce, so spelling you have to read. Okay, it is transmitted by Phlebotomus argentipes. Option B is the correct answer. The next question. Appearance of Burton's lion in lead poisoning is options. Option A bluish purple line on the gums, option B greenish coating on the gums, option C brown staining on the teeth, option D pale pinkish gums. Appearance of Burton's lion in the lead poisoning is a blue purple line on the gums, that is known as Burton's lion. Okay, this is the features of lead poisoning. Okay, bluish purple line on the gums. And the next question. Infections that appears within 48 hours of discharge from the hospital is called options. Option A community acquired infections, option B hospital acquired infections, option C localized infections, option D chronic infections. And the correct answer is it is hospital acquired infections. Infections that appears within 48 hours of discharge is known as hospital acquired infections. Infections which occurred from the hospitals is known as hospital acquired infections or nosocomial infection. It will occur from 48 hours of admission in a hospital or within 48 hours from discharge of the hospital. Okay, within 48 hours of admission or within 48 hours of discharge, that is known as hospital acquired infection or nosocomial infection. Move on to the next question. Most common nosocomial infection is options. Option A respiratory infections, option B skin infection, option C bladder infections, option D all of this. Nosocomial infection means infections which is occurred from the hospital. So the most common nosocomial infection is respiratory infections. Option A is the correct answer. And the next question. When the patient is acquiring infections during the low immunity state is known as options. Option A cross infection, option B iatrogenic infections, option C opportunistic infections, option D nosocomial infections. And the correct answer is it is opportunistic infections. Infections which are occurring during the time of low immunity state, that is known as opportunistic infections. Mostly these opportunistic infections are very common in case of AIDS, acquired immunodeficiency syndrome, that is HIV patients. Move on to the next question. What is the place within which microorganism can thrive and reproduce? Options. Option A portal of exit, option B portal of entry, option C pathogenesis, option D a reservoir. Questions once more. The place within which microorganisms can thrive and reproduce is known as A reservoir. Option D is the correct answer. A reservoir means anything that is a person or an animal or a water or a soil or any substance, it is a plants or any substance in which an infectious agent normally lives, multiplies, reproduce and allow its transmission to susceptible host. Okay, that is known as reservoir. It means the infectious organism multiply in any substance and it transferred to other species, that is known as a reservoir. And the next question, a Robert Koch discovered the etiologic agent of options. Option A typhoid, option B smallpox, option C tuberculosis, option D polio. Here in this option, a Robert Koch discovered or Robert Koch is associated with tuberculosis. Option C is the correct answer. Koch postulate or Koch phenomena was formulated by Robert Koch. Okay. Today we discuss questions from community health nursing. In the next video also we can see another set of questions from community health nursing. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle.